Welcome. Today we're going to be discussing rational emotive. Steven, take it away.
Rational emotive therapy is when you take a person's self-defeating beliefs and change them so that their emotions improve and they feel better about themselves.
That is correct. And today we're going to have a little presentation for you. I'll be the therapist. Steven is my patient. And we're going to be doing the ABC method first, and then you'll see role playing. And I hope you enjoy this video. Come in, Steven.
All right.
Alright, my name is John Murphy, and I'll be your therapist. Now, Steven, I want you to open up and tell me a little about yourself.
Well, right now I'm working at a cashier at Walmart. It's not really that bad of a job, but I wish I could do something maybe a little better, make a little more money.
Okay. Now I want you to tell me a little about your social life.
Well, recently I haven't really been hanging out with my friends as much as I usually do. We have fun when we hang out. I just really haven't felt like doing it anymore lately.
Alright, have you lost interest in any of your work or other activities that you might do outside? Or do you just not feel like you don't have the energy?
Well, I'm not really doing much other than working, so I guess I just don't have the energy for it anymore.
Do you feel that the drugs that you wrote about may be doing this to you?
I didn't really think of about that, but that's probably the reason why.
Alright. Now you said that you want to get yourself back on track when you signed up for this. How do you feel that you've gotten off track in the first place?
Well, a couple weeks ago, I got arrested for disorderly conduct while I was high, and when I got back to work, my boss threatened that if I ever got in trouble again, he'd fire me.
Okay. Now, do you feel the need to use drugs, or do you feel that your friends might be peer pressuring you into using them?
Well, one of my best friends was the first person that introduced me to the drugs, so probably peer pressure.
Okay. Now, how closely do you hold your friends in regards to your personal life?
I hold them pretty close. They're a pretty important part of my life.
Now, I'm going to go lay this out on the table for you, Steven. Throughout the course of the therapy, I'll help you in the future, or try and get you to work on in the future with your friends, your relationship with them, and I want you to think seriously on how your friends and family might affect your life. And when you come back, I'd like you to explain what you've come up with. But that'd be all for today right now.
All right. Thank you, doctor.
Okay. See you next week.
You too.
Alright, Steven, come on in. And welcome back.
Hello, doctor.
Alright, did you think about what I asked you to ask?
I did, sir.
Alright, please share with me what you thought.
Well, I thought for a long time about this stuff, and I realized that my friends are super important in my life. I don't know what I could do if I didn't have them. Well, I guess I could always find other friends, but I'm not sure I really want to try that.
And what do you think about your family?
Well, I thought about them, and I realized I don't really spend much time with them anymore. I kind of feel like I'm disconnected from them. But I guess maybe that's because we live so far away.
And now tell me some things about your friends that might make them so important to you.
Well, whenever I'm around my friends, I always feel a lot better than I am before. And I know that they'll support whatever I do, but I feel like if I stop using the drugs, that they're going to stop liking me, and then I won't have any friends anymore.
So you feel trapped.
Yeah, I do.
And how does that make you feel?
Well, I feel like I'm trapped. I just don't know what I can do. I feel hopeless.
Do you feel that your friends will accept you no matter what?
Yeah, when I think about it, yeah, I think so.
When you don't do drugs, you'll be happy and your friends will still accept you, right?
Yeah.
Alright. Good. Now, that'll be your homework, though, for the rest of the time that you're through this therapy.
I'll give it some thought.
Alright. That's all we really have for today, but I want you to talk to your friends about what would happen if you didn't do drugs with them, but only as much as you feel comfortable. We don't want to press the issue at all right? And I want you to try and change the way that you might think about the situation.
I'll try, Doctor.
See you next time. Welcome back, Steven. Come on in.
Hello.
So tell me, how'd it go with your friends?
It didn't go so well. I couldn't talk to them about not using the drugs anymore.
It's okay, Steven. There's not really a rush to do this. What we do here will not necessarily kick in over a week. And so pretty much we'll just have to keep working on it. And today I want to try something a little special with you.
What do you mean by special?
First, I want you to tell me a little bit about your best friend.
Right. Well, I've known him for about 10 years. He's a really nice guy. He's not really the smartest person out there, but that's not really important. He's really easy to get along with, but about 2 years ago was when he first introduced me to the drugs. Other than that, he's okay. Oh, and he was the one that bailed me out of jail.
Is there anything else that you can tell me about his personality?
Well, sometimes he gets mad a little easily. It doesn't really happen that often. Sometimes he's sarcastic, and I can't really tell if he's being serious or if he's joking. Other than that, he's really a happy guy, and he's pretty fun.
Alright, Steven. For this little special something, I'm going to have you pretend that I'm your best friend.
I'll try.
Alright. Now, I'm going to sit right here, and I want you to tell me that you're not going to do drugs anymore, but I want you to treat me as if I was your best friend. Okay? What's up, Steve?
Hey, Carlos.
What's up, man?
Not much, man. You?
Man, you always say that.
Sorry.
Is there something on your mind, man? You look kind of perturbed.
I'm not sure. I was just thinking about something. Don't worry about it. It's not important.
Steve, alright? When someone asks you like that, I want you to actually stop avoiding the issue, and I want you to just say what's on your mind. If he's your friend, you should be able to open up to him, and he'll understand what you're saying, alright?
Alright.
You're going.
Yeah, there is something bothering me, Carlos. I've been thinking, and I don't want to do the drugs anymore.
What's wrong with you, man? You're not having fun doing what you do? You're always the life of the party, man, when you're high.
I know. I just don't feel comfortable using them anymore.
Is this about getting arrested? Because I bailed you out for that, man.
I know you did. I just can't risk getting in trouble anymore, though. I could lose my job if I get in trouble again.
Alright, man, it's not that big of a deal. You don't have to do them in the first place. That's all I'm saying.
Really? Are you sure?
Ciao, man. No big deal.
Thanks, Carlos.
Now, Steve, was that so hard?
No, not really.
Well, let's see what we got here. Get some notes. Alright, granted, things might not happen exactly as they do here, but if he's your friend, it should be pretty similar, alright?
I understand. You know, you're not that great at pretending to be Hispanic.
I'm 50, get over it. Now, do you think you can confront him about your problem?
I guess we'll find out.
Alright then. So just remember that if he is your friend, that this shouldn't be that big of a deal. But if he decides to not be your friend over something like this, then he wasn't even worth your time in the first place, alright? Can you remember that?
I will.
Alright, and I'll see you in a week.
See you later, Doctor. Studio manager.
I know. Come on in, Steven.
Hello, Doctor.
So, you finally did it, did you?
I did. It went pretty well. I talked to Carlos. He didn't have any problems with me stopping the drugs.
And how do you feel your social life's going right now?
It's so much better than it was before. I finally feel like my energy's starting to come back to me. I've been spending so much more time with my friends.
And, what about your job?
It's going well. I don't have to worry about getting fired anymore, and my boss is even offering me a raise.
That's great news. So, it seems everything's cleared up with you. Is there anything else that you want to discuss?
No, Doctor. I think this is the last time I'll need to come here to therapy.
That's good. Can't stand you much more anyway.
I could say the same thing about you, old man.
Well, if there's nothing else you want to talk about, I think we're done here.
All right. Thank you very much, Doctor.
No problem. Oh, and Steven.
Yeah?
Thanks for making me rich. over here next week. Come here. Golden. I really hope. Capture the gold.